this episode of Africa Health Check.
We, as the youth, we have a firm voice. We have a voice that can be heard better by our own youth, by our fellow youth.
As youths, we should be given more employment opportunities, especially in the community health sector.
We shine a spotlight on Africa's community health champions.
Malkia stands to offer to enhance equity in education by reducing the barriers to transition when it comes to education, especially for adolescent girls and the youth.
And the positive impact they have on community health.
Over the last 2 years, we at Africa Health Check had showcased many powerful and inspiring stories of champions in communities across Africa who made a remarkable contribution to the fight against COVID-19. On today's episode, we will be discussing empowering community health champions. I'm your host, and I welcome you to Africa Health Check. I'm joined by our experts, Dr. Marianne Mureithi, the chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achempong, who is a pharmacist and a pastor from Ghana. But before we hear from our experts, let us have a look at this episode's feature story.
So my name is Jedi Lemaron, or Jedida. That's my full name, Jedida, but I am used to Jedi. So Jedi Malkia Lemaron. I acquired Malkia so many years ago, and it has over the years even stuck more because of Malkia initiative. I was born in Loitoktok, a town south of Kajiado and south of Kenya as well. I am Malkia is not Jedi. I am Malkia is every person, be it male or female, who is willing to stand for the girls and with the girls that we work with, because if we can all mold the generation that we want to see, then I think that is the greatest thing we will do to ourselves. The harmful cultural practices is a whole thing. So we cannot sit back and say that it does not happen. We cannot sit back and say that women are not going through barriers, that they so often have to jump barriers and barriers and barriers. So Malkia stands to offer to enhance equity in education by reducing the barriers to transition when it comes to education, especially for adolescent girls and the youth. Working in pastoral communities, I just don't know, but my people can be tough to deal with, okay? And I love my community, I love my culture, but we still have very retrogressive cultures that we are holding on to, and that is what we say no to. So I think the convincing of the community to leave behind part of the retrogressive culture is what is the biggest problem. We are still seeing a lot of GBV in the community, a lot of harmful practices, which is still the worst form of GBV. FGM is the worst form of GBV that can ever happen. Just ensuring that all these changes and making them understand why it needs to end, it is an issue. Making them talk about some things. We had a really big challenge just introducing menstruation and just talking about menstruation in this community, because it's a taboo topic. We don't talk about sex and sexuality in totality. So it was, how can we ensure that we do no harm while we have to speak about some things. My hope for the future is to be able to reach every ward in these sub-counties and ensure that they gain from our work, but also to expand some of our projects into beyond Kajiado. I am looking to move into other pastoralist communities because then we have seen what has worked here, and we would want to replicate that in other communities, especially the very rural, the hard to reach areas. That is where we want to get to.
Really inspiring and selfless work of a young person who has just taken it upon her responsibility to contribute and add value towards improving health outcomes in her community. Wouldn't Africa be better if many of us were just like her? You know,
Indeed.
You just see a problem and you decide, I'm going to go an extra mile and do something, you know, either raise awareness, educate the public, even about controversial or contentious issues. Like she's saying that menstrual health is a taboo issue, but she's seen the need to raise awareness about that. And that is exactly what she's doing. So who are the community champions that we're talking about, Reverend?
They are people who have voice and not just a noise in the community. They are people with integrity that have won the trust, the respect of the community. When they speak, people listen. When you offend them, everybody turns against you. Those are the community champions. And in healthcare promotion, especially in Africa, Africa is kinship, is communal. So anything you want to do will find great success and achievement if you channel it through community. So then the community leaders, the chiefs, the political leaders, the pastors, you know, faith-based organizations, their leaders, if you can channel whatever you want to do through them, you can guarantee that you get high success. So those are the community.
The gatekeepers of community, the people whom we believe in, we follow their example. Right. You know, their leadership is trusted. There's so much confidence in them. Why do we need such people as champions for health?
Oh, we need a voice. We need a voice. And as Reverend has said, we need a voice that we trust. We need someone who can champion some safe health practices. For example, we are coming out of the COVID-19 era. This morning I read of a new virus or a new mutation of COVID-19, and there seems to be a rise of hospitalization and cases, but that's a story for another day. And we needed voices, we needed trusted voices to go to the communities and teach people about washing hands, wearing masks, and social distancing. And we could not just use, we saw the example in America where the president would stand on TV, but he was so, sorry to say, but quite divisive that some of these messages were lost in that political noise. We do not want very important messages such as safe health practices lost in political noise or clamor. So that's why we need a trusted voice. And these are the community health champions, health leaders, the youth that have taken that mentorship. But to have that voice, they needed mentorship. And that's why you, me, Reverend, we come in. We need to be the example, the role model, so that we can nurture a talent, nurture a voice, and then direct or shepherd them to what we want them to be. I'm involved with educating medical students, and I'm always a champion of vaccines. It's something in me about safe way vaccines should be advocated because, Gigi, they're the greatest tools we have to eliminate diseases. We never hear of smallpox anymore. Polio is more or less eradicated in the world. How did you do that? Through vaccinations. So I'm trying to span the next generation of medical doctors, medics, to be champions of vaccines. And we start right early so that once they finish school, they go out there. They're the ones asking mothers or their patients coming in, oh, do you know there's a HPV vaccine? And again, now with that, stimulate a discussion within a society or a community.
Absolutely.
Can I give an example
Please, go ahead.
of what Dr. Mariam is saying? When COVID came and then the fact of taking the vaccines became an issue, misinformation, all kind of things, and a lot of Christians, took a backseat and they wouldn't want to be there. Then one of our faith leaders, a very prominent person, religious leader in Ghana, came on TV and said, I have taken the vaccine. I've gone for my first shot. I've gone for my second shot. And everybody says, oh, if this spiritual man If this man of influence has taken the vaccine, there is nothing wrong with it. Come and see the response within the week and the months following. That is a community.
Yes, absolutely. I totally agree with you. And maybe just to share an example from Botswana, because, you know, as many people know, at some point we're the hardest hit and had the highest prevalence of HIV and AIDS, you know. And one of the things that was really pivotal and significant in the response was the engagement of community leaders, the chiefs, the religious leaders, and they started preaching messages about the importance of knowing your status, not having multiple concurrent partners, and so on and so forth. So just to echo what you're saying about the importance of engaging the gatekeepers of community, but we have to empower them, right? Because sometimes having a voice and influence does not mean that you have the right message, right?
Yes. Yeah, because you can also be advocating the very wrong message.
Absolutely.
And driving so much work.
Derail.
All the way backwards.
Yes.
So we have to also be very careful.
Absolutely. Maybe perhaps one of the things we could touch on is just looking at public health broadly. What do you think at current are the key messages that we need community champions to actually be raising awareness about, Reverend?
Well, still the vaccines, even though we are almost out of the woods. I was discussing this with Dr. Mary, whether we have reached herd immunity. And he says, I don't remember exactly what she said, but he said, as it is right now, there is a whole wide range, mosquito, fight mosquito, don't litter things around, pools of blood, like Dr. Marianne was saying, tires, collecting water, mosquito breeding in them. But I think sanitation is a major issue. And if our leaders could come in. I went to my hometown during my mother's
burial
and come see plastic bags all the way. So it occurred to me, what if the chief of this town confer with the schools and say that once a month, all schools, 1 hour, the children will go around and pick these things up?
Yes.
Wouldn't that be great?
Yeah.
Fine. But if the chief gets up to say it, or the pastor, because this is a mission school, it will be done. And this is and I'm channeling the same thing to sanitation and other things.
Yes.
So that's an example of
so cleanup campaigns. Yes, absolutely. And Dr. Mary Ann, what do you think it's a key public health matter we need community champions to lead on?
Well, to add on, yes, well, the wash issues are very important, water, sanitation, and hygiene. But for me, I'm very passionate about sexual and reproductive health, particularly amongst our youth. They need to be well educated, well versed, well protected. Because again, I do not want to have the youth now dealing with either unwanted pregnancies, early marriages, or infections that seem not to go away. And these infections cause infertility in the future, and many other complications. So I would want to see more champions talking about sexual and reproductive health, where they can seek services, where they have discrete services if they need to be checked by a doctor. And the other major issue that's facing our communities is mental health. We don't know where to go. So we need to create safe spaces where I can come and talk about what I'm going through. And let's not stigmatize mental health. And let's create spaces where people can talk to their religious leaders, to a doctor, psychiatrist, but a place where they can talk and get some really needed services such as counseling or address a trauma that has been haunting them for a very long time. So for me, those are my key health issues right now. But if I was given a multiple choice, I'd also sneak in vaccines. Yes.
Of course, yes, because that is an area that you are particularly passionate about.
We had to cope up with COVID-19 was we had to start now working online. Those companies that had the capacity to work online, that's how they started working online, people. But it still has an impact because we have a lot to cope with because of some other companies yet have not even opened, and people are still looking for employment in this pandemic era.
What steps do I take to maintain a healthy lifestyle? For me, long walks do it for me. Yeah, and some breathing exercises, some stretching in the house. But generally and genuinely, given my day-to-day life and how hectic it could be, long walks do it for me.
The measures I've put in place is to live life and accept it daily, as you know, as though there's no tomorrow, because the way COVID came in to affect each and everybody, I think it was unexpected. So since we've all had an impact, we should live a way better life and comfortable life, just so we can be able to face any pandemic that comes up at us again.
Earlier on, we're talking about the kind of capacity, empowerment, and education that, you know, our community leaders and champions need. One of the things that we try to do at Africa Health Check is actually to try and inspire and motivate people to actually stand up and take action, start where they are within their communities and spheres of influence to actually make a difference in their communities. So for anyone watching and thinking, I actually want to be a champion in my community, what advice, what tips would you give to them, Reverend?
First of all, identify with the community. Let them feel that you are part of them. Let them feel that you care for them. And then serve them. Service is one powerful tool that wins the heart of anyone, anywhere. So if you want to be heard when you speak in that community, they want to see a track record of relationship, of service, of what you've done for them. And then when you get up there and you speak, everybody will listen. Not when you have, you know, despised them and you have done atrocious them in the community. You don't have integrity. Nobody believes you. You have great ideas, great motivations. You speak. Nobody will listen to you. So to me, the starting point is how you identify with the target group. Start from minimal or small, in small things, and then build it up. Build it up. A time will come when you speak, people will listen.
Absolutely inspiring. Dr. Marianne, advice for somebody who wants to be a community champion, a leader in that community, and advocate for health outcomes.
Yes, I want to echo on what Reverend has said, identify the community. But for me, there's also adding another layer, identify a problem that the community has. Because each community has very unique challenges. I was featured today, she talked about menstrual health and gender-based violence. Again, she found a solution to such a matter. And another person in another community may have totally different challenges, such as having climate change. Climate change, or with climate change, women who are using firewood to cook and do everything. They have to go to the forest and get the firewood, come and cook. The smoke has a quite adverse health effects on that family. So what solutions can I have? Maybe it's create a very good oven, or what we call here in Kenya, a jiko. And I've seen such youth come up with very innovative clay kitchens to avoid the smoke that then affects these women's health outcome in the future. So identifying a problem that is unique in your community is key, and then I'll come up with the solutions. And I trust the youth to be very innovative. Absolutely. Very innovative out there in Africa. So let's work together, identify the common problems within your own specific community, and then with you, you'd be the change that is needed.
Absolutely. And may I just add that even in coming up with that solution, make sure you engage the community. Don't assume, don't think, oh, this is the solution they need, and then next thing they're not actually uptaking this innovation that you brought because you never engaged them in the process and to create ownership. Just to give a final parting shot and wrapping up the show, I want each of you to share with us one person who is a public health champion, a community leader who's been very impactful in your life. Could be somebody you know of or somebody you've met, but tell us what they did and why they have influenced your life as a public health practitioner. I'll start with Dr. Marianne.
Well, I can speak too, but for me, my number one is as a local leader. She's a senator. She sits in parliament, and she's taken up menstrual health or menstrual hygiene. And she is so fearless because she turned up in parliament with, she had a leak. So she had some blood menstrual stain in her clothes.
Oh, is that the MP we saw trending?
Yes.
Wow, I remember
she's
that.
Ignited
very powerful statement
in the country. Like,
yes.
whoa.
In the world,
I remember, like,
yeah.
oh my goodness. But she was like, I want to draw
make
attention.
a statement.
Yes.
Yes.
And now when you drive through Nairobi, you see big posters about menstrual health or menstrual hygiene. There are girls who are not going to school because they lack sanitary pads. What are we doing about it? And now we start talking about these sanitary pads. How can we empower these girls? Some use leaves and some actually don't even go to school during that time of the month. So we are now talking about it in the country right at the highest level in Parliament. Laws have been created, policies have been created, and for me, it's wow.
I do remember that story, Dr. Marianne, and actually it wasn't just impactful and influential in Kenya because I saw it, and I'm from Botswana, and I saw it through a South African broadcaster. So this did spark a conversation much, much broader beyond the borders of Kenya. Can you please remind us the name of the senator?
Yes, she's Senator Gloria Oroba.
And
Senator she's a champion because we are all talking about without feeling ashamed or embarrassed about menstrual hygiene and having those conversations in our offices, in Parliament, at home. Because I mean, my young girls were all cringing when we saw it in the news, but now we are now talking about it and reducing that stigma. Because we want to see our girls thriving in school, in colleges, at our offices as well. And to do that, we need to destigmatize menstruation, normalize it,
normalize it,
Senator
and
Gloria,
have the conversation.
Well done.
Yes, that's where it starts. So, Senator Gloria is your health champion. Very good choice, Reverend. Who's your health champion?
And nobody comes to mind readily, but I do know that there are people who have done outstanding work in this area. I need to be specific and not to be able to cite.
Yes. All right. Not a problem. I guess you are also a champion because you are a public health enthusiast and activist. Even being on Africa Health Check is because you've done so much about public health in Ghana. Yes. Thank you so much for that. But before we wrap up today's show, I'd like us to take a look at our African health champion for this episode. Mother Inspires Foundation from Ghana is our African health champion for this episode. They train public health champions on community behavior change, which is the major focus of health and sanitation promotion activities. Let's have a look.
The Mother Inspires Foundation embodies the spirit of Africa Health Champions, fostering community development through girl child education and joyful learning. Based in Ghana, they are committed to change. They hold reading and mentorship clinics and a Youth Empower Summit, mirroring women health champions who advocate for well-being. With health screenings, community forums, and partnerships including MTN Ghana and UNICEF, they drive holistic progress. Their interactions with luminaries like Gifty Auntie echo the collaborative efforts of gender equality advocates. In education, empowerment, and health, the foundation stands as a beacon of transformative change, illuminating a path towards a brighter African future.
Really powerful and inspiring work. Keep up the great work in Ghana. And that brings us to the end of today's episode. From my awesome Africa Health Check team and I, we give you a big thank you for tuning in. Remember to subscribe, like, share, and leave a comment on all our digital platforms so that you may form part of the stories we highlight here. Follow us on Facebook, Twitter, YouTube, LinkedIn, and Instagram. The handle is @Africa Health Check. Until we meet again, same time, same place, same date. Remember, the future is Africa. The future is today.